Thank you very much. Our next speaker will be Dr. John Rachow from Physicians for Social Responsibility.
There's too many devices up here, and none of them are mine. No, it's fine. Good morning, everyone. Thank you for coming. It's a great honor to be in sharing the same presentation with the Special Rapporteur, Mr. Grover, whom I have not met before. I was quite nervous coming into this, but when I heard hunky-dory used 3 times in the Special Rapporteur's presentation, I realized that I was among people, which in the larger context is the arena in which we're thinking in terms of people and individual people and the humanity involved. A little bit about myself. I am representing Physicians for Social Responsibility. I've been a board member for 6 or 7 years. I was the board president in 2011. And after the Fukushima accident, we put together an ad hoc committee on radiation and health. And I temporarily chaired it, and now we've made it a permanent committee of our organization. And I continue to be the chair of that committee. So we have followed the events in Fukushima with great interest. PSR is also part of a larger NGO community that is concerned about all matters nuclear. And PSR is the U.S. national affiliate to the International Physicians for the Prevention of Nuclear War, IPPNW. And we have had a collaboration going regarding the upcoming UNSCEAR report about what it might contain, what conclusions they would draw, and we have spent some time as a group looking at the report, actually the temporary summary report. Before I began my medical studies, I completed a PhD in chemical engineering, so I'm fairly familiar with engineering techniques, applied mathematics, the way you have to take information and apply it and I was thinking that the precautionary principle, that we have to be careful. It comes out in engineering with what we call the safety factor. And when designing things, you have to build in a safety factor, usually 3, sometimes 10 times the capacity that whatever you're building should be able to handle and manage. Does the microphone work? Okay. Sorry. So, and in my medical studies, I did bench research for a while, and I'm acquainted with generating primary data, analyzing its validity, drawing conclusions from it, and I understand what you can say with validity and confidence about a set of data and the way it was collected. So with that kind of arrangement, I became a doctor, and I'm now a hands-on practicing geriatrician in Iowa with the frailest of the frail, the oldest of the old. So I'm accustomed to working with individual patients and families who are in various degrees of the last stages of life. Physician for Social Responsibility came into existence a little over 50 years ago in trying to deal with the radiation effects of fallout from atmospheric nuclear weapons testing. And soon after, a study was published by PSR physicians and scientists that collected baby teeth and showed that they contained strontium-90, which could only come from the atmospheric nuclear testing that was in this country. And that single study was very helpful in leading eventually to the ban on atmospheric testing. And also just 50 years ago this last summer, JFK and the President of the United States used a quote that we think is very applicable to the current UNSCEAR report. And I'll just read it. The number of children and grandchildren with cancer in their bones, with leukemia in their blood, or with poison in their lungs might seem statistically small to some in comparison with natural health hazards. But this is not a natural health hazard. And it is not a statistical issue. The loss of even one human life, or the malformation of even one baby who may be born long after we're gone, should be of concern to us all. Our children and grandchildren are not merely statistics towards which we can be indifferent. July 1963. I had just graduated from high school then, and was pretty much unaware any of this was going on. Although I lived in Nebraska, which was one of the highest areas of fallout from the repeated atmospheric testing, and so for all those years of my life, fallout was raining down on me that whole time. And that bothers me a little bit. We've harmed ourselves more than we've harmed our enemies in some ways. So I think the human rights message that we are speaking about today is exemplified in this JFK quote 50 years ago in a special way, and I'm glad that we were able to identify it and use it in this context. So the UNSCEAR report actually is a summary that doesn't include any of the data or the real thinking or discussion or presentation of how the data was analyzed and how the conclusions were drawn from it. It is simply a presentation of conclusions, which is, I guess that's not hunky-dory. It's not only that, it's bass-backwards. One of their key conclusions was there's no acute health harm from radiation in the event, the Fukushima accident. That, on the face of it, makes sense. We're not aware of any cases of blatant radiation sickness or radiation-induced death in the short months afterwards. Then they say that no future expected harm is expected. And then they point out that the main harms had to do, if any could be identified, were with the evacuation itself. Frail elders died, people had heart attacks, people died of natural causes that they may have died of anyway, but they're attributed to the accident and the evacuation. And there were some 587. And that's a number that's used in the report, partly to diminish the fact that there weren't any direct radiation deaths. And then they made an incredible statement in the report, and I imagine that in the final report this may be reworded. Quote, while risk models by inference, not conclusions based on analysis of objective data, by inference, suggest increased cancer risk, cancers induced by radiation are indistinguishable at present from other cancers. Thus, a discernible increase in cancer incidence in this population that could be attributed to radiation exposure from the accident is not expected. This, I think, philosophically is a classic tautology. It doesn't belong in this kind of a sophisticated, globally significant, national policy determining report. It's Actually, it makes me wonder if there really were any scientists on this committee. So our analysis of at least the summary report, which is drafted in concert with PSR and IPPNW, in our report there's listed 10 particular questions we have that need to be addressed or concerns we have. I'm going to summarize them in kind of a nonlinear way, lumping things together. One of the points made in the report is that Japan was very lucky, and I think most people would agree that Japan was not only very lucky, they were very, very, very lucky, because in the early stages of the accident, it suddenly dawned on everyone and came to the front of the state world stage. Attention about spent nuclear fuel stored in the cooling pools in each of the reactors. With some incredible information is that the spent fuel is where the toxicity is. There's more radiation there by far than is in the core of the reactors. So much attention is focused on the reactors rating melting down. Well, the real danger is in cooling pools melting down. And the amount that was there, and the fact that the cooling pools, you can't put them in cold shutdown like you can put a reactor in cold shutdown. All the spent fuel in pools around the world have to be cooled in perpetuity until somehow they are taken out, put in casks, and buried deep in the ground where presumably we will be safe from them. But until then, they have to be cooled in perpetuity. And when there's a nuclear power plant blackout, loss of power, they can't, the power plant can't function. Any of its functions are dependent on outside power. Cooling pools in about 72 hours will heat up to the point where the water shielding begins to boil. And the concern of the Japanese government was, is this could actually be happening in one of the 4 reactors at Fukushima. And if that would have happened, even though Tokyo is, 180 miles from Fukushima, approximately, they were thinking, seriously, the Prime Minister says so, we were thinking seriously of evacuating Tokyo, which is an absurd concept. It's not possible on an island nation. There's not that many ships. So, yes, they were lucky. And then the report says, well, it was just the wind. They're lucky because of the wind. The wind blew it all out to sea. One of the first steps to say that this was a minimal accident, and it's one of the reasons why nobody's really going to be harmed, because most of the radiation was blown out to sea. Then they treat the data that they're analyzing and the conclusions they're drawing from information drawn from like the first year of monitoring data after the accident. They're treating it as though the accident was a one-off, like a natural disaster. The storm happened, it's gone, things are calm, now we're cleaning up. Fukushima, like Chernobyl, didn't happen, it's still happening. And in the summer of 2012, the National Diet of Japan commissioned an independent Nuclear Accident Independent Investigating Committee, and they published their report a little over a year ago. Quote, the Commission recognizes, this is from the report, that the residents in the affected area are still struggling from the effects of the radiation, so a year and a half later. They continue to face grave concerns, including the health effects of radiation exposure, displacement, the dissolution of families, disruption of their lives and lifestyles, and the contamination of vast areas of the environment. There is no foreseeable end to the decontamination and restoration activities that are essential for rebuilding communities. So it's an ongoing process. Chernobyl was buried in a mountain of concrete, which gave some temporary reduction to emissions. The concrete mountain that it was buried in has deteriorated, and a 100-year solution is now being rolled out to build a great dome over the whole complex, but may not last for more than 100 years, but that's the design for it. So that's an accident that's going to be with us for way beyond our lifetimes, and Fukushima will be. And what we know about what's happening at the power plant in terms of the underwater river running through the basements of all of the buildings is now admitted to have been certainly happening since day one. And it has only been acknowledged recently. The attempts to pour water into the reactors to keep the reactors cool, the melted down spent fuel, for a long time there was puzzlement why they were pumping more water out that was radioactive than they were putting in. Well, now the answer is there. And this particular kind of a problem is not tractable from an engineering standpoint. Our report, one of our criticisms is that the data sets used may not include independent neutral sources from monitoring around the world. I am pretty sure will have data from the CTBO, Comprehensive Test Ban Treaty Organization's worldwide net for radiation monitoring, which is quite sophisticated. But as there's other independent national and private organizations that do monitoring around the planet, including citizen monitoring in Japan, all that data ought to be included. It interestingly chose a definition for children that does not include children who were in utero, the unborn children at the time of the accident. And there is exquisite sensitivity to the embryo, human embryo, which is about the first 8-10 weeks or so after conception. And this is the one area possibly where data from Hiroshima and Nagasaki can be useful, in that studies of people who were in utero at the time of the blasts have been identified and studied, and there is a high incidence of microcephaly, small head size, and mental retardation that correlates very nicely with the distance from the blast, and therefore the exposure to that single massive X-ray dose, high energy radiation dose that was received. But they exclude the unborn in that definition of children, and their definition is infants, children, and adolescents. And in the report they have a fairly extensive, somewhat rambling analysis of childhood sensitivity to radiation, and they point out that yes, children are more sensitive in certain organs and for certain kinds of cancer, but they're actually more resistant than adults for other kinds of cancers and other types of malignancy induction. The effect is to say, there may be a little more of one kind of cancer, but there'll be less of another kind. I don't care. I don't want any more cancers. That kind of reasoning in a sophisticated report, I hope is not present in their final report, and they find a way to address the risks to children in a more scientifically competent way. The report says that monitoring for thyroid cancer is important, but they really are not clear that this has to be done for decades. And they just don't think that it's necessary to monitor for non-radiation, non-cancer chronic illnesses. And there is evidence out there to suggest that heart disease especially is affected by long-term low-dose radiation exposure and other internal organ diseases as well. And the last area that we are concerned about is they dismissed entirely the effects of Fukushima radiation on the biota, the flora and fauna of the environment that was exposed by contamination. And they base that on criteria for assessing where damage might occur to the flora and fauna from a report from their, 51st or 53rd session 12 years ago, 11 years ago, which had to have been based on the literature that had been collected up to 1 or 2 years prior to that point. So this is old criteria based on very old research, and they don't account for 10 years of important on-the-ground biological radiation studies that have been done in Chernobyl, and studies comparing effects on biota and humans in areas of the world where there is naturally low, relatively, and naturally high radiation levels. And that research suggests there are effects. More trouble. It's good to live where it's okay to live with natural radiation. We've evolved on the planet, but it's even better to live in an area with low natural radiation. That's all discounted out of hand. And I'm a Nebraska farm boy. I grew up on the farm. The land is in my blood. I had the privilege to tour some of Fukushima Prefecture August 2012 with a group of international physicians and our Japanese colleagues. We traveled from Fukushima southeast, roughly parallel to the high radiation areas. We visited several places along the way. We stopped at Kawauchi Village and spoke with the mayor, who was very optimistic, but was facing very difficult problems of all the young people have left the community and they don't expect to come back. They still have serious decontamination problems, but he was optimistic. It was heartbreaking to listen to that presentation, because as we left Fukushima and drove through the verdant hills, it's beautiful, beautiful country. The fields are manicured. They are much neater than my own living room. They have special plantings around the edge. It was a pleasure to travel. Everybody yakking and chatting on the bus. Suddenly, nobody was talking. And it was like we were in a war zone. There were weeds everywhere, abandoned buildings. We passed a cemetery on the hill that was decrepit. And suddenly, everybody realized that we were in the evacuation zone. This was 18 months after the accident. And the speed with which this beautiful land, human habitations, generational homes that have been inhabited by the same familial line for tens of generations. In the United States, we think of a legacy farm as being maybe the same family has been farming it for 100 years. It's in Japan, some of these homes are from several hundred years, in the 1300s. They're abandoned. Multi-generational homes, multi-generational families taken out and divided according to age and placed in different temporary housing. This is really heartbreaking. So we have submitted our report to UNSCEAR, and we received a very courteous and we think responsive reply of acknowledging it, that our concerns are noted and that some have already been addressed, they felt, in the upcoming full report, and that they will consider other points that we have raised. So we take that in the most, as very encouraging to us. And it also gives us the hope that we'll be able to continue some kind of dialogue if we can find what I would like to think of as a tillable, my agrarian roots, tillable common ground in which a debate or conversation at some level can take place with not only NGOs concerned about radiation issues, but with the Human Rights community, and actually other UN organizations like IAEA, the World Health Organization, the Food and Agricultural Organization, and the World Meteorological Organization, all of whom are observers and participants to some extent in the operations of each other's functions. And there is a striking similarity between the conclusions drawn by UNSCEAR and conclusions presented by the World Health Organization previously following Fukushima. And so, but it's not surprising because many of the people are involved in many of the organizations simultaneously. So some of the thinking is the same. So we would like to see some form of conversation continue that can maintain honesty and mutual respect above all, and that we all exercise caution when we're trying to draw, and be circumspect when we're trying to draw conclusions, scientific conclusions, based on data that's sparse. It's incomplete data and has many areas where everyone agrees there's uncertainty. Is that we have to maintain an open mind and uncertainty that we can't make yet we cannot make definitive statements. And I think we can ask of ourselves, including the organizations, NGOs, UN as well, is that we all can expect from ourselves a firm commitment to the truth, which is, I take as a working definition of the concept of satyagraha. And if we do anything else, if we proceed the way we are and approach this any other way, we will be committing one of the 7 social sins proposed by Gandhi of science without humanity. Thank you.